Okay, so let's be critical about problem-based learning now, because it's important you think about these things and not just look at the advantages, but look at the disadvantages. Not just look at how you may fit in and how you may not fit in with that type of a learning method, but you must be able to critique these things, all right, and do it so in a fair manner, looking at both aspects, all right. So we shouldn't just be emotional about these things. We should be quite objective and academic about these things, so that in a interview situation you can critique these things in an objective manner, all right. So can you think of any pros and cons of the PBL system? Have you just take a moment and think about it? Think about some positives and think about some negatives. Shall we think about the negatives first? Perhaps it might be an idea just to do that, and then we'll think about the positives. Well, the first thing I would tell you is, certainly from my experience, I actually find problem-based learning to be a bit more stressful. When I was a student, I found it quite stressful because I was actually doing a lot of the work. The other thing I found was that actually it was stressful as a teacher. I've also, as a doctor, I've sat in to facilitate these groups, and I find that actually quite hard work. I much prefer to do a old-fashioned style delivery where you do a lecture and you leave, answer a few questions, and that's it. But actually, it's not as easy as what some people might think. There's a lot more involved. I also find that both for the teacher and for the students, it's actually quite a time-intensive exercise. So it's not just, you sit there and you listen or you fall asleep halfway through. You just can't do that in a PBL session. It's very much proactive. It's very much needing your input all the time. You have to be alert and be involved with everybody because, you don't want to let other people down. You want to contribute just as much as anyone else. So it is actually quite an intense process, and it's quite involved over a week. So there's a lot of work to be done in a given amount of time. Students doing PBL are actually very busy people. There is a risk, some of you might say, that actually because it's student directed, that you may end up covering less content, that you might actually not do enough work. The actual level of work might be shallow. Now, there might be some element of truth to that. For example, if your facilitator isn't strong, for example, if your group isn't very strong, you may find that you don't cover enough. Although I would say these days universities are very good at directing those groups well. So, having strong facilitators, well-trained facilitators with you, mixing the groups up properly so that there's a good mixture of academic ability, ages and genders and so forth. They also make sure that you stick to a certain amount of curriculum detail as well. And not only that, remember earlier on I talked about the hybrid model, the integrated model. Well as work done yourself as a group, there will also be supplementary workshops, webinars, lectures and so forth to support the learning as well, so that there isn't many gaps left. So I'm not sure if that's too much of an issue nowadays. The other thing, again, which might be an issue to need to think about is, do you therefore perform less or don't do as well in exams? I don't think there's a lot of strong evidence for that, but certainly it is a criticism that you might not cover material in as much depth or in as much breadth really that's required for doing well in exams. I don't recognize that as a problem myself, but certainly it's a potential con that you need to think about. I've also come across situations where scenarios haven't been constructed well, cases haven't been constructed well. So because the case isn't well constructed, it's not deriving really good learning outcomes. Again, over the years, universities have wisened up, cases have been refined and improved. So these days, as a teacher, I come across the PBL cases, the CBL cases, which are a lot better constructed, a lot more thorough, and actually are quite comprehensive. So it's less of an issue, but one can argue it's still a bit of a problem. Group dynamics is another one you need to take into account. Again, as facilitators, we do our very best to make sure you function well as a group. And of course, you're all adult learners at university. You're all grown-ups. You shouldn't be, I was going to say like kids, but even kids, they're very clever people. What I'm saying is the group dynamics are important. So it's important that everybody works together, everybody pitches in as much as they get out. You shouldn't just be sponging off everybody else's work, just taking on the learning away and that's it. No, you need to be able to contribute as much as you get out. So that's important. It needs to be a constructive group. You need to have good manners. You need to have respect for one another. You can't be overbearing or underbearing. You can't be destructive in the way you relate to others. So these things are quite important to kind of make sure that the group dynamic works well. I also find that actually prior life experiences in some ways are important, in some ways aren't so important. So it's important to take that into account. A postgraduate student who has done, say, physiology or physiotherapy or something like that as an undergraduate degree, they may bring a certain amount of experience to the table, but it's important to not let that skew other people's learning. That could be potentially a negative thing and affect the group dynamic in a often positive way, but sometimes it can be destructive. So that needs balancing out as well. All right. So I've gone through a few things that you need to think about. If you look at the reciprocal, the positives, there's plenty there that you can think about, in that it is a student-centered approach, in that you will direct it. You will kind of set the hooks of learning, shall I say, and then put on the learning onto those hooks. That's a brilliant way to learn. It's an excellent way to retain knowledge as well. So you might find actually that is something that suits a lot of people. Because you have to talk to one another, because you have to engage with one another, it's a good way to develop communication skills. And I'm sure you'd agree that as doctors and dentists, that's a really good skill to have. So that's not a bad thing to be involved in. Equally, because you're working with other people, you're very early on in your career as an undergraduate student, you're developing the ability to work in teams and be able to understand the nuances of working with teams, with people who you get along with, people who you don't get along with so well, and you have common points of reference and terms to understand and to get a job done, even if you might not like somebody. So it really does help develop your team working skills. Critical thinking as well. I find students of PBL, they develop a lot more of a critical mindset. They're able to question, they're able to say why, what if, what about that, what about this, that kind of an attitude. And that's not a bad skill to have as a medic or a dentist, because really throughout your lives you need to be an inquisitive professional. Otherwise, really it's not a good idea to be a robotic type, monotonous person and you want to do medicine and dentistry. You're not going to survive long if you're not inquisitive minded. I've kind of already covered this, but what you've done essentially by doing all this is you've developed some very, very important lifelong professional skills. Lifelong skills like working with teams, lifelong skills like being inquisitive and then going on answering those questions and developing your practice as a result. Something we call the learning cycle. You're getting better each time, right? One level of learning takes you to the next and to the next and to the next. PBL does that well, and this is something that we always do as part of being medics and dentists. Another thing as well, if you look at studies, if you look at research studies, is that people who create those mental hooks and questions, what they do is they actually go on and develop knowledge in a better way, because you've created that mental hook and then you've gone and answered that question through reading and learning and so forth. You actually retain that knowledge better. So actually your knowledge levels last longer. All right. There might be an argument about the depth and the breadth of that knowledge. However, one thing that cannot be argued with is you really keep that knowledge better in you. To give you an example, remember that breathless person I was talking about earlier, and you went and learnt about the lung and the anatomy and the physiology and everything. Because you've put it all together, that knowledge will stay with you longer than, say, lots of kind of separate lectures, one on the anatomy of lungs, and then another week later, another one on the pharmacology of respiratory drugs, another one on the biochemistry of lung fluids, another one on the anatomy and the physiology of the heart, another one on the pathophysiology of the lung, another one on the pharmacology of respiratory drugs. You see, it's hard to knit all that together as compared to doing it the PBL way or the case-based way. So these are a few things that I think you need to keep in mind. Between the two, I have the feeling that I think when you're working as a team, when you're contributing, when you're learning together in an active way, actually I think it's a more enjoyable way of learning. So you might find that is something it kind of strikes a chord with you as well. So those are kind of some of the pros that you need to think about.